Okay, we're going to start into the GradConnect process now. All right, so this is the process that you will all need to undertake to apply for any positions in WA Health. But first, okay, before we start that, I quite often get asked from students, what else can I do, okay, to help or support myself along the way in terms of nursing and midwifery. Now, I'm not doing this for a big plug to get more numbers, but I'm just giving you the opportunity to be aware. We have next week on Saturday night at the Crown, we have our WA Nursing and Midwifery Excellence Awards. Okay, so that is basically our showcase of all our nurses and midwives in WA, showcasing the wonderful work that they undertake. And we have awards for different categories. We've got Graduate Nurse of the Year, we've got Research Nurse of the Year, we've got WA Overall Nurse of the Year. So this is a wonderful celebration, and especially since we've been going through COVID, and it's really highlighted the wonderful work that nurses and midwives actually do. Okay, it's a wonderful way to celebrate. So I said to my team at the Chief Nursing and Midwifery Office, I said, wouldn't it be great if we had some student nurses there so that they could really understand the different areas that our nurses work in, from rural and remote to the different specialties that they work in. So I'm inviting you all, okay, go on the website and have a look, and if you would like to attend next week, you don't have to book a table of 10, you can go along with one of your friends, okay, and you will be placed on a table, okay. I do understand that you're students and money might be a bit tight. They're about $165 a ticket. But for those, there might be a few of you there who might be really interested in getting glammed up, okay? The who's who of nursing is going to be there. So as well as having an understanding of the wonderful work that our nurses and midwives in WA do, it's an opportunity to network, okay, with the who's who of nursing and midwifery in WA, okay? So go and have a look to see if you're interested. The applications, not the applications, the registrations for it close tomorrow. So I know it's only quick turnaround. Okay. So GradConnect. What is GradConnect? Okay. It's the online centralised recruitment process for newly qualified nurses and midwives. It represents all health service providers, what we call HSPs, in WA that offer graduate nursing and midwifery programs. Okay, so we don't represent any private providers. Okay, so if you're looking for a position in, say, Ramsay or St John of God, okay, they don't recruit using GradConnect. The process is actually facilitated by the Chief Nursing and Midwifery Office and is coordinated through the Grad Nurse and Recruiter Reference Group. Okay, so I'm a nurse. I'm a perioperative nurse, okay, by trade. That's what I say. That's my passion. And I now work in the Chief Nursing and Midwifery Office in the Department of Health, and I oversee the workforce issues. And my main focus is graduate nursing and midwifery. Okay, so I facilitate the GradConnect process. So a few of you already may have received an email from me. Okay, and those of you who will apply to GradConnect will be receiving a lot more information from me. So I facilitate the process in the office, but I don't run it. Okay, I have a team of recruiters. Okay, the GradConnect Recruiter Reference Group, many of whom are out on the stands outside, and we meet once a month. Okay, and we go through all the process of GradConnect, the issues, the selection criteria, what's happening, what we need to do differently, what we need to improve. Okay, so and those recruiters are all from WA Health, so they're all from the hospitals, okay, that you're wishing, to apply to. All right, so that's where the GradConnect is from. So it's an online recruitment process that's facilitated through the Chief Nursing and Midwifery Office. So when we talk about HSPs, okay, this is getting into a bit of the lingo. All right, so it's really important that you understand what HSPs are and what the different health services are. Okay, so we have health service providers in WA Health. We've got South Metropolitan Health Service. Okay, so that's Fiona Stanley, Rockingham, okay, Fremantle Hospital. All right, so usually they're groups of hospitals, okay, in one health service. We've got East Metropolitan Health Service, so we've got Royal Perth, we've got Bentley, we've got Armidale. Now, I may have missed a couple when I go through this, so don't quote me on it. But it's really up to you guys to research, okay, the areas that you want to be in. But know that they are, WA Health is divided into health service providers. So we've got North Metropolitan Health Service. There's Sir Charles Gardner Hospital, Osborne Park. They also overarch North Metropolitan Mental Health Service. We've got Child and Adolescent Health Service, which includes child and adolescent community health. And we have health support service. So that is not actually a service that delivers care to patients, but it's a service that's in St George's Terrace in the city. And they provide all those support services such as payroll and Nurse West, like our agency or temporary casual nursing pool for WA Health. Okay, so that's the different health service providers. And then we have, in the Department of Health, the system manager, okay, and that's our Chief Nursing and Midwifery Office. So a few of you, okay, may have heard of our Chief Nursing and Midwifery Officer, Robina Redknapp, Dr. Robina Redknapp, okay. She's my boss. Okay, so, and we, in the Chief Nursing and Midwifery Office, we look at all overarching issues in nursing and midwifery in WA. So we have a principal nursing advisor for workforce, we have a principal midwifery advisor, and we have a principal Aboriginal nursing and midwifery advisor as well. Okay, so there's lots that go on, and like I said before, my focus is very much, my portfolio is graduates and undergraduates and looking at the workforce and how to get you into the system, how to transition you into the system. And this is how today came about, is that we wanted to ensure you guys get the best information, the most accurate and up-to-date information at a time when you're thinking about applying and transitioning into the workforce. So this is what the GradConnect website looks like. So I encourage you all in the next week or so to go online and have a look, and you'll see there's 3 points there. Okay, it says GradConnect, it says Transition to Practice Forum, so I'm sure all of you have already been on there and had a look because that's how you registered. And then we have our NHS Grampian Recruit Australia program. Okay, so those of you who haven't been on the website for a couple of weeks since you've registered, if you go back on, you'll actually notice that it's all been updated with all the relevant information that you'll be seeking for today. Okay, so who's offering what and all the information that I'll be giving you today. So, times are changing. Okay, and this is a positive thing for all our graduate nurses and midwives. Okay, so what I want you to do is don't think about any conversation that you've had with previous graduates, okay, because they would have said, oh, it's really hard to get a grad program, it's really hard to get a job, there's so many graduates out there, okay. Things are changing. You may have heard in the last couple of weeks the Minister and the Premier promising extra positions. Okay, there are hundreds more available positions out there. And we're working through that at the moment, looking at those strategies, implementing the strategies, okay, to increase the numbers of graduates transitioning into our system. Although COVID hasn't been, fantastic for countries. Okay, the flip side of it is that, it's really highlighted the need, okay, the need for our wonderful nurses and midwives. And so the government's really had a look and gone, you know what, we need more nurses. We need to be able to provide that appropriate care. And COVID has also enabled us to have nurses working in different areas as well. All right, so it's been quite an opportunistic time. As much as COVID has been devastating, it's also been quite opportunistic for our nurses and midwives. All right, so I just want you to don't think about what everyone said before, because we have got changes to our eligibility criteria and we've got changes to our process. So what you think might have been happening or what's gone on before is actually going to be changed. And this is what we're announcing today. So this is why we wanted you all here and everyone online to ensure that you're getting, okay, the accurate information that's happening today that we're going to be announcing. Okay, so first of all, the eligibility criteria for GradConnect. First of all, you have to be an Australian or New Zealand citizen or permanent resident of Australia. I'm going to skip to number 3. I'll go back to number 2 in a minute. It has not been more than 2 years from the completion of studies at the time of application. Okay, so not at the time of ARPA registration, but the time of application to GradConnect. Okay, so it can't have been more than 2 years since completion of your studies. All right. You have to be a new graduate who's not previously participated in a graduate program of the same cohort you're applying to. So what that means is if you're an EN converting to RN and you've done an EN graduate program, that's fine. You can still do an RN graduate program. Okay, or you're a midwife going to RN and you did a midwife program, you can still apply for an RN program. Okay? So you see number 5 there. I've struck that out, okay, because we're not putting a limit on the hours that you've had to have worked before applying to GradConnect. So what we used to say is that you can't have worked any more than 988 hours prior to your application to GradConnect. All right? There's no limit. Okay, we know that you have to, when you graduate, you have to get work, you have to still be able to support yourself and support the families that you have. Okay, so you can still go out there and work, whether it's at an agency or working at aged care home or working in a medical centre as a registered nurse, enrolled nurse or midwife. Okay, but there's no hour cap before you actually apply to GradConnect. So that will make a significant difference to a few nurses out there who've already registered. Okay, and they're making sure that they're not, going over their hours before they actually start. Now I'll go back to number 2. So you have to be eligible for registration as a registered nurse, enrolled nurse or midwife with the Nursing and Midwifery Board of Australia. So, okay, the NMBA. The change to the process this year is that we used to have a main process which opens in July, and that would recruit for all the positions, the majority of positions for next year, okay? And there would be a smaller process which is really only ever open for enrolled nurses or midwives in March. We're scrapping that now. What we're doing is having 2 processes, one in July and one in March, all right? So they will have equal opportunities. Okay, equal opportunity for you to apply to those programs. Okay, so it won't be one health service will be offering in July and one will be only offering in March. Okay, they'll be divided equally or almost thereof for you guys to be able to apply. So what that means is that we only want those nurses and midwives, okay, applying to the program in their last 6 months. Okay, so it's equal opportunities, okay, for everyone. So if you're in your last semester, your last 6 months of studies, then you would apply to July. And then if you finish at the end of the year, you would be eligible to apply for March. Okay, so if you're applying in the July process, you must have or be eligible for registration in the January. And if you're applying in the March process, you must have or be eligible for registration in the July. Okay? Any questions about that? Because that is a significant change that we have undertaken for GradConnect. Now, I know that there's going to be many of you out here who are probably not in your last semester and thinking, well, why am I here? This is really important information for you guys to understand. And also, the tips that I'm going to give you, okay, is going to help you whether you're in semester 1, 2, 3, 4, 5, 6 or 7. All right, and this is why I like to get everyone, I like to have all semesters here, is because I want to give you the education on what you need to start doing as a professional when you're on prac. All right, any questions? Yes, out the back. Okay, so the question was, how long does it take ARPA for you to get registered? Now, something that we can't control. We do know that at times there's been significant time delays. However, we are working with AHPRA, okay, to ensure that those students who get registration, who get positions in WA Health, they will be fast-tracked. Okay, so we are working with it because we do know that AHPRA, at the same time every year, has hundreds or thousands of applications, because it's not just from nurses and midwives, it's from doctors, okay, any regulated industry, they get the applications from, okay. However, my advice to you all, and this is also included in my presentation, is once you are nearing the end of your studies, okay, you can start applying for your AHPRA registration no more than 6 weeks out. Start doing it at that 6 weeks out. Understand what the registration process is. Okay, don't wait for a job offer. Okay, and this will become more apparent as I go on through my presentation. So, when is GradConnect opening for this year? So there's a few of you all thinking, oh, I want to know. Okay, opens on Monday, July 5th, okay, of 2021. It closes Monday, July 19th at 12 p.m. Perth time. That is 12 p.m. midday, okay, lunchtime. We always have applicants. I always get a few applicants who are devastated because they've put their application in and it's been 12:01 and the digital timestamp 12:01, and we're unable to accept their application. It's not me, it's actually the online process. All right, so please make sure you're aware that it's 12 o'clock. Don't wait until, sorry, I've had something flash up there. Don't wait until the last 15 minutes to upload your application. Things happen, okay? Computers crash, okay? Your watch might not say the same time. It might be 1 or 2 minutes difference, and that could be the difference between your application getting uploaded or not. Okay, so the call for interviews will be between July 19th to August 27th. Offers will be made Tuesday, August 31 at 3 p.m, and they'll be emailed and they'll be available to see online. Okay, every now and again I like to catch everyone out and everyone's waiting for 3 o'clock and 10 o'clock's come in the morning and I've sent them out then. Okay, because otherwise I get everyone going, oh, it's 3 o'clock and I haven't got mine yet. So you'll get it on, if you're getting an offer, you'll get it on that day. All right. So it's really important for you to go and have a look on the website for the applicant important dates, okay, and who's participating, what programs are going to be offered, and that's on the website as we speak, okay. Please print out that important dates, all right, because I still get a few emails going, when are the offers coming out? And I'm like, it's on the sheet there. Everything is laid out on that important dates sheet. So, other important information, okay, preference for interview and appointment will be given to local WA graduates with Australian citizenship or permanent residency or New Zealand citizenship, okay. So that means most of you guys here, okay, you'll be prioritised. We want to prioritise our local graduates. All right. That doesn't mean to say any interstate graduates, you're not eligible to apply, okay, but we do give preference for interview and appointment to our local graduates. And as a measure to increase the Aboriginal nursing and midwifery workforce, Section 51 of the Equal Opportunities Act applies to all GradConnect vacancies. So I really encourage any of our Aboriginal nurses or midwives, okay, to indicate their ethnicity in GradConnect. So, you will need to contact or visit each hospital's website for the specific information on their programs. All right, so that's why we've got all the recruiters out here, and that's why we've got the panel this morning, is so that you can ask all the information about what is their program looking like, what specialties do they offer, do you rotate around different specialties, all right, so what they're offering in their grad programs. Okay, you'll see we're starting to change the terminology now from grad programs to transition to practice. Okay, grad program and a transition to practice program is the same thing. but transition to practice program is more contemporary and more aligns with where we're going as nursing and midwifery workforce. So like I said, the links are available on the GradConnect website. So with mental health registered nurse programs, they're offered through each health service provider. And you have the ability, okay, to undertake postgraduate study in the mental health specialty, and they're partnering with a specific university. So that's a fantastic opportunity, okay, for anyone interested in mental health nursing as a registered nurse. You will be supported and funded to do a couple of units at university to get a mental health qualification. So new for this year, now this is a mouthful. Okay, so Charles Gardner Osborne Park Hospital Care Group, Perth Children's Hospital, Armidale Health Service, and Fiona Stanley Fremantle Hospital Group. Okay, they're all combining their preference, okay, for a peri-op program. So who's interested in peri-op? Excellent, because I'm a peri-op nurse too. Okay, and those of you who's from Notre Dame, who knows me? Okay. There you go. So for those of you who don't know, I teach in the peri-op unit at Notre Dame. Okay, so I'm really excited for this new program. Okay, it's still going to be different hospitals offering their graduate program, but we're combining it into one preference. Because, little tip for everyone, if we're doing specific specialties like mental health and like peri-op, okay, that's a good indication that there's a great workforce need. Okay, so we really want to be able to highlight to all our hospitals who's interested in peri-op, okay, because there is a need for peri-op nurses out there. Okay, so we also have King Eddie. They're offering their own RN graduate program that includes a specific peri-op program. All right, so they're kind of a few new things for this year. All right. So tips for preparing your best application. Take a professional and proactive approach. You all are, you're all here. Okay, well done. Use your clinical placements as an opportunity to network and research, okay, the health services culture, mission and values. Okay, so when you're on prac, you're at lunch, don't go and have lunch with your friends. Have lunch in the tea room with all the nurses. Get to know them, get to understand what it's like working in that hospital. Talk to them, ask them questions. That's really valuable, okay, knowledge for you to get, okay? And it's easy because you're already there on prac. Use your CPATs or your NCAS or your clinical placement journals as resources to provide clinical examples, okay, in your application. They are gold. Don't think that it's just something I'll have to fill out for uni, okay, and then put it in the back of a cupboard, okay? They will provide the foundation for those clinical examples that you will need to provide on your application for GradConnect. Take the time to prepare a high quality application. Don't leave it to the last minute, all right? You'll have 2 weeks for an application. The GradConnect is open for 2 weeks. Take that time, all right? It's competitive. Okay, so there's no guarantees of employment. You need to take, okay, the time and a professional approach to it. So a link to the online application for enrolled nurses, registered nurses and midwives will appear on the website. The link will only be available during the advertised times. All right, so you won't be able to click on the link because there'll be no link there. It will be up on the day when GradConnect opens. So what will you be asked? You'll be asked some screening eligibility questions, demographic data, contact details, where did you complete your studies? Now, these aren't anything that we give any preference to. We just need to know where you're coming from. So don't think that because you go to ECU and you go to Murdoch that we're going to, preference ECU, okay? No, it's just demographic data that we're looking to see where our workforce is coming from and going to. There'll be further research questions that will not impact on the outcome of your application, i.e. previous participation in something like the Get Real Experience and Try program. That was a secondary work experience program undertaken WA Health. Anyone here an ex-GREAT participant? Oh, a few of you. Excellent. Come say hello to me later on because I probably would have been the facilitator. I used to do that program as well. Oh, that's really fantastic to see. We must have done something right. Okay, so you'll be asked for 2 professional referees. This is where I go on a little bit of a rant, okay? Ensure you have their permission and updated contact details. Use your clinical placements, okay, to find some referees. Now, I'm not advocating, you didn't have a particularly good experience and asking someone who's not going to give you a good referee, be a good referee. If you know that you've performed really well and you've really made a good professional relationship with someone, ask them to be a referee. But don't expect that in semester 4, they'll remember you in semester 6 or 7. Okay, it is up to you to say, hi, would you mind being my referee? Here's my name, here's my contact details, and here's the picture of me. Okay, that's what I'll tell you about my creepy student file in a moment. It is up to you to maintain contact. So every couple of months, hi, it's Natalie. Just touching base, hope everything's going well. You don't have to be their Snapchat, Instagram, Facebook friend, okay? It's not a social relationship, it's a professional relationship. Is it still okay for me to use you as a referee? Don't assume that 12 months later that they're still happy to provide you with a reference, okay? And that they actually remember you. They actually may not even be working in the service, and so you need to ensure that you're constantly being in contact with them. Okay? Ensure they're available to be contacted during those dates that we talked about in the GradConnect process. Okay? Some might be on holidays. So that's why I really encourage you, okay, to start using your clinical placement so that you've got maybe not just 2, that you might have 3 or 4. People might be on holidays, people might not, might not be available. Okay? So start thinking about those professional referees there. Now, when I used to be a clinical facilitator, and a few of you might have heard this story, when I used to be a clinical facilitator at Charlie's in the peri-op unit there, I used to have a lot of students say, Natalie, will you be my referee? And I said, yeah, sure. Come back to me, take a copy of your NCAS or your CPAT, which is where I had to put the comments in. Give me your email address. Let me take a picture. Okay, and I used to say to them, make sure you contact me every 6 months or so when you're going to be using me. All right, and I would have, okay, a file of all those students. Okay, so that when I was contacted to provide a referee, I could dig them out and go, oh, that's right, that's the girl with the red hair. Okay, and I'd be able to provide appropriate, okay, feedback or referee. And all my colleagues used to call it my creepy student file. Okay, but it's funny how a lot of them now have adopted that same process. Okay, because I like to be able to go, no, I know who that student is. I'm not trying to remember back 12 months ago because I've had so many things going on in the previous 12 or 18 months. Okay, so at least one of them must be a clinical nursing or midwifery supervisor or facilitator with the ability to comment on your performance in a nursing or midwifery clinical setting. Okay. We prefer 2 clinical nursing or midwifery referees, but if you don't have 2, it must be at least 1. And they're commenting on your performance as a student midwife or a student nurse. So what will you be asked? You'll be asked to highlight or give your 3 preferences, okay, of programs. Putting the same preference 2 or 3 times will not increase, okay, your chances. So I've seen applicants who have put, I want to go to Charlie's, I want to go to Charlie's, I want to go to Charlie's, okay? Doesn't increase your chances, it actually decreases your chances of getting a position because you won't be swept anywhere in round 2 if we have a round 2. Choose a site that you want to work for, okay? Don't choose a site where you think, oh, Nadine out there at Royal Perth, and you'll meet Nadine, she's hard to miss. Nadine's a really easy marker, and she'll give me a job. Okay, it doesn't work like that. All right, choose somewhere where you want to work. Okay, not where your mates want to work. Okay, not somewhere where you think they've got more positions than anywhere else. Okay, the recruiters out there are looking for someone who wants to be a Royal Perth nurse. They want to be a Fiona Stanley nurse, or they want to be a Charlie's nurse, or want to be a WACS nurse, WA Country Health Service. All right, choose somewhere where you want to work. All right, research and understand the mission and values of working in those hospitals. Most sites will fill their vacancies first round, so it's highly unlikely to be offered a position if there is a second round. I'm not saying that it's definite you won't be offered in second round, but it's highly unlikely because most hospitals, okay, fill their positions in first round. Second and third preferences are only there just in case, all right, there's still one or two positions available, all right? It's the first preference, okay, that makes the difference where you want to work. Do not play, okay, the odds from rumours or campus chatter about who's easy, who's hard, who's got the most positions. It changes every year. And I've seen applications skewed from one site to another just because of people talking and going, oh, they're really easy, or they've got hundreds of positions, or I'm not going to apply there because they've only got one position. Okay, I've seen it all. Okay, choose a site where you want to work. So what will you be asked? So we're coming down to the nuts and bolts of it. 4 selection criteria. Don't we hate selection criteria? Okay, but we all have to do it. Okay, even in the Chief Nursing and Midwifery office, going for the position I did, I still had to do it. So what we're trying to do is to give you the learnings, okay, start you on the track to understand what selection criteria is. They're not going away. We might not like them, but we still have to apply with them. So they are assessed against a standardised marking guide, regardless of the site of preference. Okay, so your application, okay, will be swept to the site of your first preference, and they will be assessed at that site using a standardised marking guide, okay, which is the same that they use at Charlie's, that they use at Royal Perth. Okay, every hospital site has the same standardised marking guide. All right. So the score's out of 25. So 6 marks per question, plus 1 mark for spelling and grammar. Don't we love spelling and grammar? Okay, you're probably sick of that from uni, but it does make a difference. All right. So for ENs and RNs, there's a 250 word limit, okay? And you can't upload any extra information, okay? That's what it is. Whereas midwives, we allow 500 words, and we allow you to upload any relevant information that you might think is relevant to your application, okay? So I've put this up there because your selection criteria is the key to opening the door, okay, to get a position. Okay, if you don't do well on your selection criteria, you're not going to get an interview and you're not going to then be eligible for a position. So it's key. All right. So the tips for a selection criteria: make sure you define what the criteria is asking and have a structured opening. Give clinical examples of what you've done in the past to support your claim. Okay, you might be fantastic, okay, customer service working at Macca's. That's great. But I want, okay, your communication skills, okay, to be reflective of what you've done in the clinical setting, not what you've done at Macca's. All right. Ensure you structure your examples using STAR, ISOBAR, or ADPI. Refer to policies and procedures and supporting processes such as ColdSPAR, MANO, PQRST, A to E, okay? So any of the policies and procedures in the hospital, okay? Put those in if it's relevant to your clinical example. Once again, ensure you check your spelling and grammar and use correct medical terminology. And don't use specialised acronyms, okay? I know that there's a word limit. BP, those standardised ones are fine, okay, but not specialised acronyms in a specialty unit. Okay, for specialty nursing or midwifery, okay, because the recruiter that is actually assessing your application may not actually know what it is, okay, because they might not be from that specialty of nursing or midwifery. Focus on the keywords in the question and make sure you cover each point. Use the full word limit and be clear and concise. Okay, so some common approaches we use when answering the selection criteria are STAR, isobar, ADPI, and SEO. So we're just going to go through these one by one. I'm not going to spend too much time because you'll be able to go back to these, okay, and then work out your own structure for your own examples. So situation, task, action, activity, and result. Okay, so that's the STAR format. Isobar. Now you all should know isobar, okay? You've all been learning that in all of your courses. Okay, identify situation, observation, background, agree to a plan, and read back or result. ADPI. Now this is drilled into my head, okay, never to be released, because this is what was drilled in my head when I went to university all those years ago, nearly 30 years ago at ECU. Okay, assessment, diagnosis, planning, implementation, evaluation. Okay, so what do they all have in common? What they have in common is that you're looking at what you're doing, okay, what you can do to improve, and what you would do differently next time. Okay, so you're always closing the loop. We're always looking for, can we improve? Can we make a difference? Did it make a difference? Okay, so that's why, so I've got people waving at me over there. So that's why you need to structure your clinical examples this way. All right, that's what nursing is about, improving, okay, making a difference, okay, making the changes that we need to for our best patients' outcomes. Okay, so situation, action, outcome. Okay, that's SEO, not the biscuit. So I'm just going to put this up here for a minute, okay? Have a look at this response to a selection criteria. So just remember it's 250 word limit. Who picked the spelling mistake? What is it? Enthroned? Okay, 177 words. Now have a look at this one. All right, so let's have a look at the difference. Okay, the difference between the two is that the second one is using an isobar approach. Okay, it's in logical order, okay, and all aspects of what's been asked for is covered. It substantiates that whoever's doing the application has got experience, and it comes across as well articulated. Okay, spelling mistakes, like I said. What about the word limit? First one was 177 words. Okay, the second one was 246. All right, use the word limit. Now we're not saying that 246 you've got another 4 words to go, but you can't get across what you need to get across in 100 or 150 words. Use that full word limit. Okay, try and create a bank of answers. Okay, in this format in advance. Okay, and this is where your CPATs or your NCASs or your clinical example journals will come in. Okay, start practicing. Okay, so then once you get to the selection criteria, you know what you're going to be putting into it. Okay, and take them with you if you're called for interview. Okay, because the recruiters want to see, all right, that you've actually understand what you've written. So this is where I'm going to kind of go off on a tangent. I'm all over the social media pages. All right? I don't often comment. My daughter knows. She thinks I'm creepy. But I'm all over them, and I see. Can you tell me anyone that provides great selection criteria and resumes? Look, that's great if you've got a few $100s. You'd be better off going to the Whammy Ball than doing that, because we see time and time again someone who is paid for an application and a selection criteria get to interview, and they have no idea what's actually in there because they've paid someone to do it. All right, it's not worth it. Okay, we're not asking for $1 million applications or CVs, okay, or selection criteria. We just want to know you understand the question and you can answer it. So it is a waste of money. Okay, but if that's what you want to do, that's fine. Just make sure if you're called for interview that you understand what's been written. Okay? Rant over. So checking over your application. Read, reread the application in question, questions and answers. Okay? Get together in a group. Okay, help each other. You might think, well, I don't want to give my friend, tips. You're competing against usually, as RNs, you're competing against usually about 1,000 other RNs, okay? Help each other. Get mum or dad, get husband, wife to read. They may not understand, but they should be able to understand it in a logical order, okay? Review your examples for each application question. Have additional examples ready for interview. Check any word limits, spelling and grammar. Okay, make sure you allow enough time on your application. If you're cutting and pasting, okay, from a document, okay, make sure it transfers over into the right format. Okay, we have difficulties at times with computers from one type of computer to another, and it transfers over, and the word limit changes because of the bars and the spaces. And I'm not a techno guru, so I don't know what that, how that happens. But sometimes the spaces are counted as a character, and someone can't get in their word their whole example in there. All right, and they've left it till 10 to 12. Okay. Make sure you go over, because you will have to, cut and paste from a document because it does time you out. All right, so you need to kind of do the selection criteria and then upload it or cut and paste it into that. All right, so you've been warned. Check the font, check all that, okay, from computer to computer. Don't leave it to the last half an hour. It does break my heart when I get those calls at 12 o'clock to say, won't accept my application, there's nothing I can do. All right. Print and save your application so you can refer to it if called for interview. And also if you're looking for feedback or you're wanting to do another application, okay, I can't by any means keep, when people ring me up, can I have a copy of my selection criteria? So there's over 2,000 applications with all the cohorts. I can't be doing that. You need to ensure that you're printing it off. Some people's computers get stolen, they blow up, they do whatever. Techno, it's not me. All right, so print and save, print them off, okay, so you've got a copy of your application. So this is our flowchart that we follow, okay, so this is really important for you guys to understand. So what you'll see is we've got the first box, we've got the online advertisements, graduate supply, whether you're an EN, RN or midwife. And it's auto-swept at the end of the application period, auto-swept to the side of first preference. And the recruiters assess every single application, okay, with a marking grid to see if it's suitable for interview. But first of all, they have a look. Are you eligible? Okay, are you eligible? Are you going to have your registration in the time frame that we're asking? Okay, has it been more than 2 years or is it under 2 years? Okay, that second one there in the red box, please ignore that because that is coming out and I just realised that last night. Okay, have you worked in a previous grad program? Okay, that will make you ineligible. Okay, but what you will see there, see how it says score, okay, under 10? That's for your selection criteria. If you get a score under 10, you're put in that pile. Never to be assessed again, never to be swept anywhere again because your selection criteria, okay, is not up to speed. Okay, is not appropriate, needs more work. You don't want to be in that red pile, okay, because you will not get, okay, another chance at any other opportunities because your application, okay, is not good enough. Now that's less than half, okay, like I said, it's 25, okay, that's less than half. You don't want to be in the red pile. You want to get a mark as high as you can. So then the assessors, the recruiters assess the application, is it suitable for interview? Now some sites, okay, will take applications maybe from 15 upwards, okay? It has to be a minimum of 10 and above. Okay, but some sites have so many applications they have to have a cut-off. They can't possibly interview 300 applicants, okay, that have scored over 10. So they will then determine their cut-off. All right? So the higher you score, the more chance you are to go to interview. So that's where that green box there, it says interviews based on position numbers, okay, and a buffer. Okay, so if somewhere like Charlie's might have 150 positions being offered, they might offer 200 for interview. Okay, so it's really up to each site. Okay, but the key for you is you have to score, okay, 10 or over. Don't be under 10. Okay, don't be in that red pile. So then you will remain suitable in the pile after interview. Every site has their own strategies, okay, for interviews. Some have group interviews, some have med calcs, all right? We don't standardise that because the sites are determining who they want for their site, okay? They're recruiting to their mission and values. So everyone then interviews slightly differently, all right? So then those will be successful in the pool and then hopefully you'll be offered, okay? There'll be offer accepted or offer decline. Phone or Skype interviews or Teams or Zoom can be arranged if you're not going to be here, if you're on placement, okay? You'll need to pre-arrange that beforehand, okay? Applicants marked as successful or suitable will be sent to the site of second preference, only if there's positions available at that site, okay? So even though you've put somewhere as a second preference and you've done well, but you haven't got a position, you'll only be sent to your second preference if they still have positions available. And remember what I said before? Most hospitals fill, okay, their positions in first round. Not always, changes every year. So like I said, all hospitals have different interview strategies, whether it's group, solo, med calcs, etc. All sites determine their own schedule and timeframes for application assessment in that 5-week timeframe that I said before. Okay, you'll be called for interviews. Okay, but they all determine which week or which date they're going to interview. Okay, so I see on social media all the time, oh my God, I've missed out on an interview because Fiona's standing interviewing today and I applied for Royal Perth. And I'm looking going, Royal Perth don't even have the interviews until 2 weeks' time. Okay, that's why you need to understand. Don't talk to each other and, get concerned or, all this anxiety-provoking information because everyone's on the social media, okay? Don't listen to it. Just go underground, all right? Because it just makes it stressful for you, okay? Every site has their own time frame. They've got the dedicated time frame that they have to get back to me on the system, on the GradConnect process, for me then to digitally send out the offers. All right, so they're all interviewing within a time frame, but they will all have their own designated dates. Okay, and that's why I say ignore social media updates and messaging from fellow students. Okay, I get anxious for you when I see it on the social media. Okay. Please do not call or email sites requesting status of your application. All right, that just prolongs, okay, the agony, and the recruiters are really busy. Okay, they can't afford to have the time to go, okay, no, we've got your application. We've got your application. You'll get an email to say, we've got your application. Okay, I know it's a long wait. I know it's excruciating. Okay, I know that it's stressful. But there's so many of you out there, we need a bit of time to give ourselves, okay, time to assess appropriately every single application. Okay, it's in your benefit. So the GradConnect process is over. Okay, successful applicants, okay, will be made an offer online through the Big Red Sky application, and you'll also receive an email from me on Tuesday, 31st of August at 3 p.m. Okay, unsuccessful applicants will be emailed no later than Friday, 3rd of September. Okay, so these dates will also change for the March process. Okay, so it's basically the same timeframes, but there'll be March dates, and we don't put those March dates up until we're finishing or at the end of this July process. Okay, So what if your application's unsuccessful? Okay? It's a 12-month process. Our recruiters routinely go back to the applicant pools to fill vacancy from applicants that have pulled out. Do not withdraw your application because you won't be considered for any further opportunities, okay, if your application's withdrawn. Seek feedback from the site of your first preference by the 10th of September. Ask them, what could I do better? Was my selection criteria? Okay, if you haven't made it to interview, it's a good sign that your selection criteria is not up to speed. Okay, sorry, that's my phone telling me I've got to start winding down. Sounds like I need to wake up. Okay, ask them. If you've been to interview, you know your selection criteria is pretty good, but you didn't get a position. Okay, you usually know how, if you've bombed in an interview, what you need to practice. Okay, but make sure you get the feedback. I've had, in the last couple of weeks, okay, people complain that they haven't got a position, okay, through GradConnect in the last 2 processes. I've gone back and I've had a look at their application. Exactly the same application for the last 2 processes. Okay, you need to change it. If you're not getting results the first time, change it, improve it, update it. Get someone to look through. Okay, if you've got a good relationship with your referee, okay, get someone to help you with it. All right, you need to change it and update and improve all the time. Apply again if you're eligible. Okay, most of you undergraduates, you'll have, okay, 2 or 3 goes at GradConnect. Okay, you're not necessarily going to get through on your first round, but know that there are opportunities. There's lots of opportunities, okay, that are coming forward. I can tell you this. You can ask all the recruiters out there. Seek out job opportunities for registered nurses that you are eligible for, or midwifery. And remember, you don't have to have a transition to practice program or graduate program to work as a registered nurse or a midwife. Okay, it's not mandatory. You can go straight in. There's lots of newly qualified nurses and midwives who've gone straight into positions. You know, maybe their last 6 weeks of their prac, okay, in their last semester, okay, they've showcased how good they are, and the nurse manager said, okay, would you like to, I'll offer you a contract. Okay, would you like to work for us? Don't need a graduate program, okay, don't need a transition to practice program. But we do understand that they're the most common pathway, and students like that, like the feeling of having a supportive network, okay? But it's not mandatory. A good unit will provide that support that a grad program will anyway, okay? So Nat, what do I mean by further opportunities, okay? We have applicants withdrawing all the time, okay, due to change of circumstance. They're unable to graduate because they failed a unit. Okay, so they've been offered a position, they can't graduate, they can't get their ARPA registration. Okay, so we have to take them out. We look at the next person who's ranked. Okay, that might be you. All right. Unable to gain ARPA registration, okay, because I haven't sat the English language test, or they have and they failed. Okay, so they can't get registration. You can't get registration, okay, you can't start work. Have this every week. Okay, so these pools, the database that I control, we go back into those pools to go, okay, here's the next person, ring them up. Do you know how many applicants I've had? I've rung up and they started crying. Okay, oh my God, I didn't think that I was going to, you know, be offered a position. I love making those calls. Okay, I actually now have to ring them before I send them the email, because I've had a couple say, I thought the email, okay, was a scam. Okay, I'm like, so I have to say now, I'm ringing you because I'm about to email. The email is not a scam, okay, it's not dodgy, all right? Happens all the time. Okay, or someone might have got a job opportunity elsewhere, okay, and they don't want to participate in this transition to practice. Okay, so if you withdraw your application, you're not going to be eligible for any further opportunities. You could be next in line for an offer, okay, you just don't know it, okay? So the additional opportunities that I've been talking about, Okay, this database provides all the HSPs with access to applicants for new positions or new programs, new money, money that we found. Okay, and you've heard about the Premier and the Minister talking about, okay, they're giving money. Okay, we're undertaking all these new strategies to give more positions. Okay, you may have heard about the Nurse West Quick Start program. That was something that was implemented. Okay, we went back to our database and said, okay, those who who weren't successful, okay, but their applications were pretty good, we'll send them an email to see if they're interested. The same with COVID. Okay, there's been COVID opportunities working in the contact tracing team. Okay, we have the COVID workforce guys out there now, okay, seeking nurses for their vaccination program. Now, if you go and work for their vaccination program, you're still eligible to apply for a grad program. Okay, but they're looking for nurses who will be registered after July or who are registered now, okay, to undertake, work in the vaccination program for the next 6 months before you start a grad program. Okay, this is where you get those opportunities in our database. Okay, the additional 100 initiative. Okay, who here applied for the MH80 initiative? Anyone? Okay, right. We keep those names in a database. We'll go back. You might not be successful, but we've got you in our database now, okay? And we can then forward emails about further opportunities, okay? And there's always extra money that hospitals find, and they go, oh, Natalie, we've got extra money. We can employ another midwife or a nurse. Okay, who's next on your list? Who's next ranked? Get that phone call. Okay, so that's how it works. It's really important, okay, that you don't withdraw your application unless you've got a job opportunity elsewhere and you're not going to be wanting any other opportunities. So, this is where I've said, I'm just going to reinforce this, okay? You don't want to be in that red box, all right? You want to be where that number 1 arrow is, and if you can't be, you want to be where the number 2 arrow is, or the number 3 arrow is. All right? If you're unsuccessful, please request feedback. All right? Now, you might request feedback from the sites. You'll be asked to probably email. Okay? They might not get back to you straight away, but you will, okay, be communicated with. They might say within 2 weeks you'll get, some feedback. So don't expect it straight away because there's lots of you out there, okay? But the communication that you have with them, okay, will log it into their system and they will get back to you when they can, okay? So last thing before we go, okay, I think I'm running on time. Please be familiar with the ARPA registration requirements. Okay, well before the completion of your studies. Start the registration process as soon as you can, which is only 6 weeks out. Don't delay it. Don't wait until you have a job offer, because if you get that call, initially you've been unsuccessful, okay, and then you get a call to say, oh, you're next in line, a position's come available, and you say, oh, I don't have my registration. Then you're going to go, oh, sorry. Next in line after that. That's happened before. I know it costs a bit of money to get your registration, okay, but if you don't have your registration when you could have had it, you'll miss out on those opportunities, okay? If you are made an offer, you need to ensure that you're pushing and getting your APRA registration, and you'll need to have it no less than 2 weeks prior to your start date, okay? So start looking at what's required now. Everyone needs to understand that we all have to, okay, provide evidence of the English language test, okay, sorry, English language registration, okay, through 3 pathways. Now, most of you who have been born and you've been educated here in WA will go through the primary language pathway, and that's providing basically evidence of you've been to high school here or whatever. But there may be a few of you who have to go through the extended language pathway or the English language test pathway. So those of you that have to go through the English language test pathway, my advice to you is to get it done and sort it and pass it. We have students who have to take it 2 or 3 times. Now, if you don't pass your English language test, you can't get registration, you can't start work. All right? So if you're one of those, okay, students, get onto it now. So that's what it looks like on the ARPRA website. Okay, that's the pathway. Okay, be familiar. And so the last thing before I go, you're successful to a program. Well done. Got your registration? Excellent. You're due to start, or you've just started, but life happens sometimes. Okay, you might fall pregnant. Okay, there might be some, devastating, significant issues that are happening in your family. Okay, or you might have injured yourself. Okay, please don't make any concrete decisions. Okay, go and talk to the recruiter at your hospital of your graduate program. All right, see what they can, if they can accommodate what you need to do. Okay, so don't just go, oh no, I've resigned, I can't do this, or no. Okay, even if there's significant emotional issues going on, okay, see how they can accommodate. Okay, the hospitals want to be able to support you, but they can't support you if they don't know what's going on, okay, and they can't provide any support for you on how to manage. All right, so every now and again I get a call saying, well, would I be eligible if I pulled out now? And I said, please go and talk to the hospital first, okay? They're not going to put you in that, rejected pile, never to speak to you again. They want to support you, and we do know that life happens. All right, so please make sure you talk to the site first to see if they can. They may not be able to, okay, but they may be able to. All right. So good luck, okay? Please go and chat to the recruiters out there. Find out the information that you want to find out about those programs. Listen to the presentations, okay? And we've got representatives from Women's and Newborn Health Service coming up to give you information on midwifery in WA. Okay, thank you.